he's going to jump in frame. Hi there. And what I'm going to do is just have him stand comfortably, and I'm going to hold his pelvis, and I'm just going to move it slightly. And all I want you to do is try not to resist, but stay in balance. And I want everybody to see how that affects his shoulders, his head. If you can look down to his feet, you can see that. So I'm going to stand here and hold his hip bones. You can drop your arms. And if I just shift this way, notice what happens. This is going to twist this knee here. It's going to potentially externally rotate the other knee. His back extensors back here are going to have to fire to hold this position and keep his eyes in front, which is going to potentially pull this shoulder forward, tighten this part of his neck, maybe these suboccipitals. That's one way it might show up. If I twist them the other way, the opposite happens. Right? Now, that's one plane, right? That's just horizontal. Vertically, if I hike one hip, look what happens to his head. Right now, his neck has to tilt the other way to keep him upright. And this is potentially going to cause plantar fasciitis on this, because this has now got way more weight happening. It's going to potentially affect this knee and these adductors, which now I'm sure you can really feel. It's definitely obviously going to hike up QL and crunch up into there, into the ribs. Opposite shoulder might thing. So that's a different plane, which would be this one, right? And so if I do that, you see this knee has to bend, this knee has to lock, so this hyperextension might show up as knee pain there. This might show up as hip pain up at the upper part. So that's a different plane, right? We talked about this rotation, we talked about that one. And then the very last one, which is anterior tilt, right? Which makes him have to massively hyperextend his knees, crunch into his lumbar. His extensors are on fire right now. His chest has to go back to balance, right? And then the opposite, which would be a really severe posterior tilt, right? Which crunches into here, elongates traps. He's going to be way tight in the hamstrings, potentially coming off of his feet into his heels, which then if he goes to run on it is going to rip his plantar fascia to shreds. So those are the sort of three planes we're going to get into analyzing, right? And most people are going to show up as some version of all three, right? Here's an anterior tilt with a hip hike and a rotation, right? Some people will literally stand this way thinking that's neutral, right? And so you want to be able to work and think about, okay, this is tight back here, this is tight in here in the front, these guys are really tight out there, so are they. This is firing much more and this is firing much more. And so you want to think asymmetrically on what to open and what to work on so that you can, hopefully, bring this much more into neutral. And make their job standing up much easier.